beautiful people. How are ya? I hope you're having a great day. I've got Lucy back here. She just got a treat, so she's very happy. Well, Tesla's down here on the floor. Well, he's not on the floor, and he's in his bed. A year and a half of me doing videos regularly every week. They kind of know what's going on, so I'm not moving until I'm done with the video. So they're waiting patiently because they're hoping secretively that they'll get another treat. I recently did a video discussing fibromyalgia as a controversial and debated condition. Mostly today, this is due to physicians and researchers not agreeing that fibro is an autoimmune disorder. Today, we'll discuss what
Yehuda.
That's what I thought, but I wanted to make sure. Today, we'll discuss what Yehuda Shoenfeld, an Israeli physician and autoimmunity researcher, believes about fibro being an autoimmune disorder. And after today's video, we'll discuss the arguments that fibro is not an autoimmune disorder. And I'll release that video sometime soon, probably the week after this one comes out. And just in case there are a few new people who need a background on what fibromyalgia is, I'll start there. According to quote, fibromyalgia is a multifactorial syndrome, which includes not only widespread pain and stiffness, now recognized as major symptoms, but also numerous other somatic, emotional, and neuropsychic manifestations. The lack of specific, validated biological and instrumental biomarkers has made FM, meaning fibromyalgia, a condition of unexplained medical significance, and its pathophysiology remains controversial and subject to debate, unquote. Currently, the hypothesis of the pathogenesis of fibromyalgia and its development is influenced by several factors: genetics, stressful life events, inflammatory processes, and cognitive emotional factors. But it's not entirely clear what the pathogenesis of fibro really is. And our understanding of the disease is still being debated. To be diagnosed with fibromyalgia, according to the International Association for the Study of Pain, we need pain in at least 4 of 5 body regions and in at least 3 of the 4 body quadrants. More on that in this video. Pain, along with stiffness, are the main symptoms, but fatigue, sleep and mood disorders, and cognitive impairment for at least 3 months is needed for a diagnosis. Fibromyalgia normally affects women in their 5th decade of life, but can occur at any age and gender. Various other conditions are associated with fibro, such as ME/CFS, anxiety, IBS, and most musculoskeletal rheumatic diseases. There are no biological or instrumental biomarkers to determine fibromyalgia. However, altered levels of pro-inflammatory cytokines such as IL-5, IL-6, and IL-8 have been shown in research to lead to chronic low-grade inflammation. It's believed that neuroinflammation, meaning stemming from the brain, occurs in fibromyalgia due to the role of the immune system. and inflammation in the pathophysiology of fibro. Neurons become sensitized and excitable in response. Our innate and adaptive immune system goes into action, which dysregulates the complex nociceptive system. Wow, that's a lot, I know. Pick out what you can. The more you hear it, I think the more you start to understand it, the more it starts to make sense. And I go over a lot of this stuff in each video, here and there, and explain different sections and subsections. And the problem is there's so much more, such as some individuals with fibromyalgia having small fiber neuropathy and anti-GPCR antibodies, which I need to do a video on, and IgG antibodies shown in mice models, and gut microbiota alterations and gut-brain axis dysregulation. A new study this year that I will discuss in more depth in another video shows elevated levels of anti-satellite glia cell immunoglobulin G antibodies present in more severe symptoms. That's intriguing, and I look forward to reading that in depth. But today, I'd like to talk about what Professor Yehuda Shoenfeld believes fibromyalgia is based on his research and the research of others. Professor Shoenfeld's clinical and scientific work focuses on autoimmune and rheumatic diseases. He's an MD, a medical doctor, and is considered an autoimmunologist. He has published more than 1,960 papers in journals. His articles have had 55,000 citations, and he's written more than 350 chapters in books and has authored and edited 25 books, some of which have become cornerstones in science and clinical practice. He has received multiple awards, prizes, and medals for his work. He runs a center for autoimmune diseases at Sheba Medical Center in Israel. So I believe his opinion matters in the field of autoimmunity. Dr. Shoenfeld stated that patients complaining of particular symptoms like chronic widespread pain, fatigue, paresthesia, cognitive impairment, sleep disturbances, memory loss, dry mouth and eyes, hearing loss, tachycardia, and many other symptoms, as well as the overlapping conditions like ME/CFS, sick building syndrome, post-COVID syndrome, and many others, that all of this has been found in fibromyalgia, will get subjected to many instrumental exams and extensive blood work. How many of you have had an enormous amount of blood work completed, usually by a rheumatologist, sometimes a neurologist, and sometimes by your family doctor? I have. The result of that blood work is generally in the normal range, so patients are considered healthy and prescribed an antidepressant or anti-anxiety drug, and the symptoms are considered functional, meaning there isn't a known physical cause for the symptoms. The body is not functioning the way it should. It doesn't mean psychological. So Dr. Shoenfeld stated that among the most supportive evidence that fibromyalgia is an autoimmune disorder are anti-G protein-coupled receptor antibodies, or GPCR antibodies, and small fiber neuropathy. Anti-GPCR autoantibodies directed against the autonomic nervous system receptors have been detected in the serum of patients with fibro, and titers correlate with clinical symptoms. These same autoantibodies have been found in patients with fibro, with other clinical conditions that overlap with fibro, such as ME/CFS, autoimmune diseases, or post-COVID syndrome. According to Ernst Witebsky and Noel Rose's criteria for the autoimmune disease diagnosis, a passive transfer of these autoantibodies should induce all the clinical symptoms in experimental models. The transfer of fibro patients' immunoglobulin G led to all the clinical findings in mice, including the development of small fiber neuropathy. In addition, anti-GPCR autoantibodies were extracted from patients with fibro and transferred to mice, did not result in the development of clinical manifestations. Then, in a new article that was written by Goebel, the lead researcher in that mouse antibody study, and David Anderson and Yehuda Shoenfeld, which was published in January of 2023, stated, quote, "The promise from placing positive resources into exploring the role of invisible, functional, non-inflammatory autoantibodies in symptom-based disorders across additional areas of medicine includes patient empowerment and the development of new diagnostic tests and therapies," unquote. I plan to purchase that article. It's $55, so it may not happen for a few more weeks, but once I do get that article, I plan on reading it and we'll have a discussion about it. I mean, it's really important to me. That sounds really interesting. What I find interesting is that it says that it will provide empowerment and development of new diagnostic tests and therapies if researchers just continue to put their resources into fibromyalgia research. So Dr. Shoenfeld also stated that, quote, "The fact that fibromyalgia is an autoimmune disease," and he didn't say might be an autoimmune disease, "induced by anti-GPCR autoantibodies also has clinical therapeutical implications. That is, plasmapheresis with IVIG, intravenous high-dose gamma globulin infusion, may have beneficial effects on patients, but would be supplementary to therapy with progressive exercise. The positive results were described in all the clinical overlapping conditions which dysautonomia can be detected. The therapeutic effect of exercise stems from stabilizing the parasympathetic arm of the autonomic nervous system." Do you all suffer with dizziness, lightheadedness, fainting, rapid heart rate, slow heart rate, that sort of thing? That's all from the autonomic nervous system, and it's directly related to fibromyalgia. And that's why I talk a lot about the autonomic nervous system and about exercising, movement, to stimulate positive results, a therapeutic effect from exercise. And so there's hope yet, beautiful people. Empowerment is key. And that's why we gather together, isn't it? So I hope you learned something. I send you gentle hugs and support. Love you. And integrate or our understanding of the debate or our understanding to be stemming from the blend and extent to rapid heart rate